Good afternoon, everyone, and welcome to today's webinar, Self-Care for Health Professionals. With us today is Dr. Sally Shaw. She's your presenter, and my name is Annie, and I'm your facilitator. We begin all our webinars with an acknowledgement. So we acknowledge and pay respect to the traditional custodians, past and present, on whose lands we meet today. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and we respect the cultural authority of the elders in each community. Just a word around informed choice. This presentation is prepared and presented by an independent expert. The views presented are not necessarily the views of Multiple Sclerosis Limited, and we ask all individuals to seek further advice regarding the relevance of the information for their situation. Okay, I'll now give you an introduction to Sally. So Sally is a Melbourne-based psychologist who's been working within both clinical and health promotion settings. Sally is currently working as a psychologist with Eastern Health MS Service and also in private practice. Sally holds a particular focus on the provision of information, education and support to people with chronic illness and to the health professionals who support them. Based firmly within a positive psychology framework and drawing largely on cognitive behavioural therapy, acceptance and commitment therapy, and through the use of mindfulness techniques, Sally works with clients to increase their abilities to be strategic while moving forward. Her doctoral thesis examined the need to take control while attempting to adapt to a diagnosis of multiple sclerosis. Sally is a passionate advocate for self-care of health professionals, and she will share her personal and professional expertise in this area during this webinar. Okay, I'm just going to quickly switch on the webcam so Sally can say hello to you and you can see her lovely face. Mm-hmm. Okay, that should come on shortly.
Oh, I can see a flashing light, so that means I'm going to, oh, hello everyone. Hi.
Okay, there's Sally's lovely face. And I will switch it off, Sally, because it would use so much bandwidth and will slow down the webinar.
Okay.
But I just wanted everyone to say hi to Sally and be able to see that she's a real human being.
Hi. And it's a shame I can't see you, but you can see me for just a sec, and Annie will turn the camera off. But we do have an ability to be able to have some communication back and forth, don't we, Annie, with some poll questions that we're going to have, and also you are very welcome to make comments or post some questions, and Annie will interrupt at the right moment so that we can have a little bit of feedback.
Absolutely.
Yeah.
All right.
So please feel free.
Fantastic. Thank you, Sally.
Okay. All right.
All right, so you're ready to go.
Thank you. Okay, everybody. Now you just get to see my fabulous slides and not me while we talk today about self-care. And I made the comment to Annie before about how thrilled I am that so many people sign up for this webinar. I think often when you are somebody that really wants to be productive, you're motivated, you're enthusiastic, you want to get a lot done in life, it's number one, you know that you've got to look after yourself, but number two, it really is hard to carve that time out for yourself. So I think taking this step to enrolling in this webinar is a really fantastic first step. Maybe some of you are well versed in self-care, but certainly after today's webinar, I hope that you can pick up a few extra strategies. So we wanted to focus the webinar on having a look firstly with the unique challenges that working with people with chronic illnesses can bring, specifically around the red flags that you might be alerted to about having to attend a little more to your own self-care, but also what to do next. So it's really, you know, it's obvious that we say, yeah, you really do have to look after yourself, but if you don't know the right steps to take in order to look after yourself, then you're left at a dead end. So we want to make this a little bit practical too today. So as Annie said, I'm a psychologist. I really do focus on working with people with chronic neurological illnesses. I work as part of the MS service at Box Hill Hospital and also here in Blackburn in private practice. What are the webinar objectives? Very important to know them as we head into them, and hopefully we'll meet them. So we want to examine why it's so important when working with people with chronic health conditions. There are several challenges that patients face if they are living with a chronic health condition or chronic disability, something that is not going to have a start and an end date, that can have a profound effect on the health professionals that work with them, and it's often not really discussed. We want to have a look at the red flags that could indicate professional burnout. And to be honest, we want to see the red flags that will identify when burnout is, approaching long before we get there, because we really don't want to wait for that point for you to take action. We want to rethink self-care a little bit. We want to move it from when you burn out, these are the things you should focus on, to actually what can we do as kind of preemptive strikes? How can we build health professionals' resilience, and how can we reduce stress? And they're two of the main areas that we'll be focusing on today in order to combat the negative effects that can come with working with people with chronic health conditions, and in order to avoid burnout altogether. There was a time where burnout was almost worn as a badge of honour, particularly amongst CEOs of private enterprises in Australia. If you'd burnt out, then that was a marker of how well you had done the job. And it's just absolutely crazy. I think we're moving away from that. I think that was probably about 10 years ago. We're moving more into showing great examples of work-life balance is a term that we all flash around, but also prioritising ourselves, our family, and our health. And in tandem with having a conscientious approach to work and wanting to do the best by our patients or our clients. I'm guessing a lot of you would use the word patients. I use clients. Whatever you'd like.
It's interchangeable.
I'll use both. Yes. Step to the self-care plan, trying to create one that is just logical for your life and can be easily incorporated and not so onerous. Let's give it a go. Have we already checked to make sure that everybody can see and hear, or not see, well, see the slides, but hear us well? If you would like to make a comment in the comment section of the webinar, the little menu, questions pane, thank you, on the right-hand side. Please feel free to say hi and to give Annie a wave and let her know that you can hear us and see us as well. Obviously, if you are experiencing problems, please let her know and she will be able to figure it out.
Yes, absolutely.
Okay. So I guess this is a good way to see if you're all there. And if you are able to hear us and see the slides, I'd like to start, I guess, the webinar by asking you a question. What is a unique challenge faced by patients with chronic conditions that can weigh heavily on the health professionals that work with them? So this is a poll, and we'd like you to go over to that right-hand side menu pane and see whether you can fill in an answer here, one of them or all that apply.
I'm actually just going to launch that for you now.
Sure.
So you won't see it on your screen as yet.
Oh, it's coming, sorry.
It is coming. It's on its
Here
way.
we go. And so the answers you might think are appropriate in answering this question could be, look, people with chronic health conditions, they might have complicated medications. It might be particularly hard for health professionals to work with them because you come across a lot of, this was a terrible way to term it, but difficult neurologists or specialists, or a lack of a team approach. If somebody has a chronic health condition, they might have a variety of different health professionals that they're engaged with, and sometimes communication can be hard. So communication difficulties in amongst that team or with the patient themselves. Maybe it's a heavy burden to carry if you're a health professional working with someone because of the mere fact that it is a chronic illness or a progressive nature to that condition that they're living with. Or maybe you find the unique challenge to be working with people with significant disabilities if that's part of their chronic health condition. So you might want to hit one of those little tabs to tell us, if you haven't already, which one or more are unique challenges. Oh, or although it does say please select one. Yes. So you can just select one that you think is the biggest maybe.
Yes. All right, I'll just give it another minute or so,
Sure.
Waiting for more people to respond. We've got 70% responded so far.
Great.
All right. They're still coming through, so
sure.
That's great.
And I mean, there are many challenges. Clearly, I could have put 20 different options for you to select from, but I think it's important to recognise that a few stand out as being unique challenges to patients in this group.
Okay. All right. It looks like most of you have responded, so I'll close that and I'll share the results with you. Okay, we can see there that 18% find difficult neurologists, specialists, lack of team approach to be the major challenge.
Yep.
Another 18% find communication difficult. 47% find chronic and or progressive nature of the illness to be the most challenging part. And 18% say significant disabilities. So that's an interesting result, isn't it?
It's really interesting. I think it's something that's lost on a lot of people, maybe other health professionals that don't work with this group. People in that acute care field where, you know, we'll pick the great example of the emergency room. You provide fantastic care in a very short space of time, and then you're unlikely to cross paths with that person again, maybe, to be very general about it. Whereas if you're a health professional working with somebody with a chronic and particularly with a progressive illness, that raises a whole lot of other challenges for you in terms of the way you communicate with that person, the way you see potentially their decline with this illness, and their expectations of you and the role that you play as well, to name a few. Okay, thank you, Annie, for that poll.
No problem.
So chronic and progressive illness is the first dot point on that on the next slide, which I find really fantastic to compare to the results of that poll. I think that really is the one that most people will talk about finding hard. It leads to that emotional roller coaster. So not only as the health professional are you witnessing the emotional roller coaster of somebody with a chronic health condition, but you might also go on your own roller coaster. I see it amongst health professionals that I work with, and you know, am not immune to it myself. When you work with someone over an extended period of time and you see a decline in their ability to cope with the illness, or in their physical mobility, in their encountering of symptoms, in changing effects that the illness has on their quality of life, it is a difficult added pressure on the health professionals that work with them. It comes with that uncertainty of future. Often chronic illness, people can have periods of stability where they are really managing their own chronic condition well, but it can also have a pretty disconcerting way of throwing a spanner in the works when everybody thinks things are stable, and then something can happen where the disease changes a little, and by the chronic nature of a disease changes over time, and that can be very difficult for everybody. This can bring questions around self-identity for the person that you're working with, specifically in this instance, and this can impact on their mood. And of course, when we have patients or clients with mood disturbances, or who are going through anxiety or depression because of the situation their illness is putting them in, that can also have an effect on our mood. Particularly if you've been working with someone for a number of years and you see a change in their mood state because of their health condition, that can be difficult for the health professionals that would like to fix things for them and unable to often. Invisible symptoms are something that we encounter a lot with people with chronic conditions. I guess I'm, you know, well versed in the area of multiple sclerosis, and invisible symptoms feature prominently there, but they can come with so many chronic conditions that we work with. Cognitive dysfunction is one of the hardest. It's hard for your client to be able to express. It's hard for them to be able to reconcile, and by cognitive dysfunction I'm speaking of, I guess, the most common being concentration difficulties, word finding challenges, memory issues, but also the ability to be able to cope with lots of stimuli at once. You know, people will talk about not being able to go to loud parties, it's just too overwhelming for them, or it might be around not being able to multitask, to be able to do too many things at once. This can be really difficult for a client's loved ones, but also for the health professionals that see them looking well and then delve a little bit deeper and realise there's a whole lot going on under the surface. Also, I find health professionals can struggle with a lack of illness-specific symptom treatments. So we know that with a lot of chronic conditions and a lot of symptoms that come, specialists might be borrowing symptom management techniques from a different disease or a different illness and hoping that it will work in the patient that sits opposite them, and the confusion around drugs and what's working for what symptom and what can help and potentially what can hinder can also be an issue for health professionals to navigate through. I think getting back to that original point that a lot of people indicated in that first poll that we did, the progressive nature of a lot of chronic conditions can be a really difficult thing for us to know whether we should discuss it with the client or the client's family, obviously with the client's consent, and how we go about doing that can present issues and can require health professionals to seek really solid supervision and guidance around that, because it has to be an area that you're happy approaching your client about, and it has to be an area where you feel well supported in. So an interesting study that was done in the UK, looked at MS nurses and looked at how open they were to talking about disability, to talking about chronic progression or an illness increasing somebody's chance of becoming disabled over time, and how open they were to doing that or how reluctant they were. And this study found that 64% of MS-specific nurses were really reluctant to talk about disability, which was a bit of a surprise, because we specialists often leave that to the MS nurses. They leave it to the nurses to do all the warm and fuzzy, to do all the communication, to be the person that the person with MS or the person with a chronic condition goes to if they want to discuss the difficult stuff of, how do I cope if my disease is progressing? And yet, in the study, we find that nurses are actually not as comfortable talking about these things as maybe we think they are. So I included that little cartoon there because I think a lot of nurses thrive on being able to give people hope, and it's a fantastic thing to be able to do. We should do lots of it, but we should also be very cognizant of the fact that sometimes we need to have difficult conversations with our patients, because that is something that they're craving, or they really want to be able to have a space where they can talk about the hard things, the challenges that chronic conditions or disability can bring. I'm aware that I'm talking so much, Annie. If anybody would like to jump in, I know that that's the point of the webinar, but goodness me, you're all doing very well to be putting up with my voice consistently. If you would like to make a comment, have a question for me, please write it down, because I would love to be able to pick up on anything you would like to discuss. Okay, so what's the impact on the health professionals working in chronic health in this space? One of the big ones is, where is the good news story? When you're working with a group of people with chronic health conditions, it takes a toll because there's no end date. We'll all get through this treatment and then we'll be fixed, is not something that enters into chronic health. It's much harder to find, maybe I should put it that way, because there are so many wins to be had in chronic health around effective symptom management, about helping somebody with coping strategies, about helping them with communicating or helping them in their workplace. There are so many little wins that can be had, but I think it can be quite overwhelming when we see a long journey ahead for somebody where we know their health is very unlikely to improve. The impact also comes when we look at the long-term relationships that health professionals have with people with chronic health conditions and the expectations that can develop over that time. So frequently, people with chronic health conditions have a team of health professionals, and they work really well within that team, seeking advice and self-managing. And self-management in chronic health is an area that is building, and I know it's reflected in the NDIS and the way the NDIS is trying to operate to empower people to be managing their health well. but it's also a difficult space when it comes to expectations of patients on what they want to get out of their health team, and how long that can be sustained for.
I guess it's a network of people, isn't it?
It is.
Sally.
It has to be a network of people in the chronic health space. It can't just be one provider does everything.
And they all have to be on the same page and going the same direction.
Yes.
Otherwise it falls over, doesn't it?
Yes, it does. And it raises a great point of communication between those team members has to be there too.
Yeah.
I often feel for GPs, I don't know if we have any GPs online today, but I feel for GPs in the expectations that everybody has on them to be that centre person and to communicate really effectively amongst all of the health professionals that might be on board. But it can be done. We've all seen great examples of where it can come into effect. Okay, so the impact on health professionals can lead to feelings of hopelessness or helplessness. And I know that they're two very distinct terms, and we don't want health professionals to feel either of these. I think often health professionals are the first to put their hands up and say, yes, they really do like being in control. Often they'll refer to themselves as perfectionists, and they like to fix things. So feeling hopeless does not sit well with a health professional, and certainly feeling helpless within the realm of being able to see real change in somebody's healthcare for the better can be very detrimental to a health professional feeling good about their job. So this can increase a lowered mood state, it can increase stress, and of course it can have a negative impact on a health professional's resilience, on their ability to get up every day with hope, their ability to get up every day wanting to go to their job and looking forward to having positive impact in somebody else's healthcare. We really want to maintain that. So feeling hopeless and helpless is not going to. And all of these negatives can increase the likelihood of burnout. So this is the part of the webinar that I ask you to pop your hand up, which is something you can do with this fabulous technology, isn't it, Annie?
Yes, that's right. So on your control panel, you should see a little, well, no, it's not little. It's a little handle, and someone's described it as looking like a rake.
Yes, it does look a bit like a rake.
Yeah, so you should be able to see that on the control panel. It's generally down the bottom, and it's normally in green. So the question was, if you have ever felt close to burnout, to let us know by raising your hand. So if I can see hands raised.
Is anyone raising their hand? I've got,
yes,
I can see that little orange one here on my screen.
Yes.
The little orange one. Yep.
Oh, yours is orange, okay. I can see there that we've got 3, 4, 5, 6, 7.
While people are responding, if you want to.
11 so far.
Okay.
Felt close to burnout.
And I wonder if you wanted to add a few comments in the little comment section, in the question section, of saying, I could tell that I was close to burnout because I'd be interested to know if anybody has any comments. There's a variety of reasons, and we'll discuss them on the next slide. But I wonder, if the people that have raised their hand, how did you know that you were close to burnout? You might be close to burnout right now, and you might be able to say, well, it's because I feel a particular way.
Okay, I'll just give a reminder to everybody. If you do want to make a comment or respond to Sally's question, you open the control panel. So click on the left arrow so it opens up, and you'll find the questions pane on the right-hand side. Scroll down to the word questions. Click on the arrow, and it will open up a box, and you simply type in your comment or question in there and click send, and we'll receive it here. So already I can see that Angela has asked has made a comment saying she doesn't feel burnt out, but she has a feeling of being overwhelmed.
Yes, and I think that is probably the most common response, that sense of, I feel like I'm close to burnout, I just feel overwhelmed. There's just so much to do, and I know that even if I went to the office for a week with no other distractions, I would still feel like it was all still piled up, is, a typical response. So thank you, Angela. Great.
Okay, and thanks to everyone for responding by raising your hand.
Yes, thank you. So how do people typically describe burnout? Well, it's a psychological syndrome of emotional exhaustion. It includes depersonalisation and this decreased personal sense of accomplishment. It's often exhibited in a much easier to understand approach of just the lowered care factor. And I've seen it, and you've all seen it before in health professionals, where there might be a team meeting and somebody raises an issue that a client's having, and the general consensus around the table is, oh yeah, it's happened before, what are we going to do? This is, almost a boring problem, it's hard to fix, oh, we'll do it after lunch, or it's, oh, can we leave it till Monday, it's Friday afternoon. And while we can all understand how that feels, because we're all, we all know that emergencies hit, hospitals at 4 o'clock on a Friday, and everybody kind of breathes out and thinks, oh, did that really have to happen? When you recognise a lowered care factor in yourself, it's a really great indicator that, this is not the intent that you wanted to bring to this job. So what's going on? Why is this lowered care factor happening? People will often report this sense of overwhelm and a decreased level of compassion. And this can lead to increased sick leave and stress leave, obviously. When people do not feel that they can bring that same level of compassion to their job, then there's a whole lot going on. But that's a really key one, I think, for a lot of health professionals to say, okay, it's sending me a very strong signal if I'm listening to a patient and I'm not really vested in wanting to assist them in the way that I used to. It's a great moment to just have a bit of a self-examination and see what's going on.
Sally, we've got a few people writing some of their examples of feeling burnt out. Alicia said that physical symptoms such as headaches, being tired, and the feeling of a pit in your stomach.
Yes.
Caroline has mentioned unable to feel that she's making a difference.
Yes.
So it takes away from that feeling of you're moving forward.
Yes. Yep. And that success, it's hard, and it really is so obvious, or it's just there in almost every turn when you're working with people with chronic conditions. You can easily go home at night and think, am I even contributing at all? Where am I making the difference here? Because every time I see this lovely person in front of me, they're getting worse, or their life is becoming more difficult. It's very hard to turn up for a job wanting to help and assist and fix someone, and coming home knowing that they're worse off, not because of your care, but because of the nature of the condition. Yeah, and it is terrible that we can't become a little numb to it. And it's natural. It's okay for every health professional to be a little bit more removed as they get a bit older and wiser, because without that, you wouldn't survive in the job without having some good boundaries. But realising you're becoming numb to the urgency of somebody's request is a good thing to have a look at.
Leslie's also mentioned that she was very close to burnout.
Yeah. Because
she felt that she had no patience with clients and fellow colleagues.
Yes.
She wasn't sleeping well and feeling extremely overwhelmed.
Yeah.
And ended up taking a couple of months off work. She's back at work now, but feeling much better.
Yep.
But only just sort of back on board now. So I'm glad you're back on board, Leslie.
Yes, well done for being back, and good on you for taking some time, because clearly you needed it. And you have to act, or else something acts for you. And we know that if you don't listen to these signs in your body will find a way to tell you to stop.
Okay, and Jane has written in to say, can you suggest a way in how to speak to another health professional about their potential burnout?
Yes, I would love to know more about that, Jane, in terms of how they're presenting. If they're being very dismissive, you don't have to answer this, but if they're being really dismissive, no, they're fine, they thrive in stress, and you can just see them crumbling almost before your eyes, I think it is important to be able to bring it up with them. Depends on the person. You can bring it up in a lovely passive way of, oh, I'm trying to figure out new techniques to look after myself a bit more. How do you do it? How do you create some boundaries in your life between work and home, or have that balance, or what is your self-care strategy? But maybe when we get to the strategies that we could implement ourselves, they might be points of discussion with your colleague, maybe, to engage them in that.
And Jane just mentioned just if she notices signs of burnout.
Yeah, okay. Yeah, good idea to engage them. Don't ignore it, certainly. Okay, so we're on to poll number 2. What is the number 1 strategy that nurses engage in to reduce stress levels? So this was a study that was done by Bennett and colleagues in 2001, and it was looking at nurses and how they reduce their stress levels. So here are the options that you're going to be presented with. Do nurses typically in the UK increase their exercise, meditation or relaxation? Do they talk to their manager about stresses at work? Do they drink more wine? Do they seek out counselling? Or do you think that they would increase social contact with supportive friends? So I think Annie's going to launch this poll, and you can see the same responses are there for you to select one. Which one do you think nurses in the UK would be more likely to engage in to reduce their stress levels?
Okay, guys, that's launched at the moment, and we're getting the responses in, so that's great. Thank you. I'll just give it another minute or so.
It'd be good if I had a singing voice, Annie, and I could do some like thinking music.
Yeah.
The girl from Ipanema sneaks into my head. But I'm not going to. I won't launch into it.
Or you can put your tap shoes on and do a dance.
Oh, yes. And interpretive dance, but then nobody can see me.
No, that's true. They can hear you.
Oh, I could fake it. And just next time, you'll have to tune into our next webinar, and Annie and I will do a rendition of tapping while singing.
Excellent.
There we go.
I might have to
something to look forward to.
Okay, just another minute.
Okay.
Or filling that out. Most of you have completed it, so thank you very much.
Maybe some people are making a cheeky cup of tea.
Could be, or they're thinking which one is the most appropriate.
Which one is the most appropriate?
Yeah.
Or the most likely, because appropriate and likely might be different.
That is true.
I can see some people might have figured that out with their responses.
Okay, looks like most of you have completed that. So I'll close it now and I'll share the responses with you. And there you go. Look at that. 12% think increase exercise, meditation and relaxation. 6% will talk to the manager. 53% will drink more wine.
Yes.
That sounds like me.
Well, they're not saying they would drink more wine. They're saying they think nurses in the UK drank more wine.
Yeah.
Yep.
6% will seek out counselling, and 24% will increase social contact with supportive friends.
So we have a very, very clever audience, Annie, because the number 1 coping strategy that is used by nurses in the UK, according to this study, is drinking more wine.
There you go.
And so this cartoon, the lady, as you can see, says, I've learned to use meditation and relaxation to handle stress. Just kidding, I'm on my 3rd glass of wine. I thought that was a lovely little, just a funny little cartoon. Yeah, it shocks not many people at all to reflect on the fact that nurses might use wine in the UK in that year, or at least the ones that were involved in this study, to counter stress. That was their number 1. This is how I manage my stress. I drink wine. And we can all understand that need to go home, particularly when you're feeling overwhelmed. If there is a crisis situation, something traumatic happens, people and health professionals are much more likely to seek debriefing, or they're more likely to understand that time in quality relationships with friends is a good idea. You know, that reassurance is important. But when we look at burnout and we look at that broad general sense of feeling overwhelmed by lots of little bits, whether it be, you know, how we feel about particular clients and how they're coping, whether it be about all the paperwork, whether it be about the time restrictions or the time pressures on your work, the demands, what you're expected to output, all of the bits that make your job difficult and stressful, when we think about all of it lumped in together, it is understandable that nurses would go home at night and say, you know what, talking about it, how is that going to help? Like, where would I start? And if I talk to my partner about the stresses at work, they're not going to be able to fix it. If I talk to my manager about this one component of work, that's not going to ease up the rest of it. If I stress too much about the health of one of my patients, then, you know, I'm doing a disservice to myself, to the rest of my patients. So you know what? The easiest thing to reach for is the glass of wine. And I'll just have one. It'll take the edge off. And then, oh, whoops, I'll have another one while I'm cooking the bolognese. And then, oh, there's one after dinner. And before you know it, it's 3 every night. And it's not a great stress management technique.
We just had a comment from a Leslie, another Leslie O, who says, I often feel quite fatigued after a busy shift, but fortunately the intrinsic rewards of knowing that I've made a positive impact on my patient's health and well-being, then I'm reminded just how much I have made a difference. I then take good care of my mental and physical health by indulging in a relaxing massage.
Great.
This is wonderful.
It is.
And welcome to using the webinar system, Leslie. First time user.
Well done, Leslie.
Well done.
And that's a great comment. And I think that if we could all tap into that, it's almost that kind of zoom out approach, and knowing that you can't fix the little things, you know, that aren't so little at the time for your patient, but that you being there is absolutely going to have an overwhelmingly positive impact on that person's life moving forward. Then it's certainly important for us to reflect on that and to use that as a sense of achievement and accomplishment when we, you know, struggle with the rest. And massages are always good, Leslie. Well done.
Yes.
Okay, so let's have a look at self-care. And the old definition of self-care was much more about, you know, the study that we just saw. And I don't think anybody truly thought this was true self-care, but that flippant response of, you know what, I have a stressful job, I've had a busy day, I'll go home, I'll have a wine or two, I'll be fine. And I'll reset and I'll, you know, go to sleep and I'll wake up and I'm ready for another day, is a bit of the old-fashioned approach to it. Certainly having a day off, or I just need some more me time, that is what I would like to see kind of fade into the distant past, because having me time in amongst a very stressful work environment, or a work environment that you're not using, you know, problem-focused coping strategies to make a better work environment, is actually just avoidance. You know, it's great to have a day off and go see a film, or have a day off and go get a massage, but we shouldn't just be using it as our only strategy to refuel a little bit and then counter all the challenges again. We should actually be trying to change some of those challenges. So being kind to ourselves, it's a statement I use often with clients. You have to step back and treat yourself with kindness and compassion like you would if you were looking at your best friend and treating them in a kind, compassionate way. But we don't want to just use it as a simple statement of, oh, I've got to be kind to myself. Okay, see you tomorrow, and not really do anything with that. We have to act, as well as thinking of ourselves as having difficult jobs and then just sucking it back up and doing it again. And then I saw somebody on a blog site, I think, saying, you know, self-care is much more than just, you know, treating yourself to some cake and then doing some yoga and thinking that that's enough. So that's the old definition. The new definition is really about, I mean, it makes more work for us, but long-term strategies are just so much better. It's really about active and regular engagement in a planned and purposeful self-care approach. So we really want to work hard to build a life that you don't need to take a day off from. So instead of saying, I'll just accept the fact that my job is busy and stressful and I'll have a day off a month to have a massage and eat some cake or do some yoga, really we want to sit down and say, no, we need to redesign the basics of the work life and the work-life balance to make sure we're not wanting to escape it one day a month or one day a week or fortnight or, yeah. And with this comes working hard to build the resilience levels. So to have a look at what resilience means, which we will do, and putting some strategies in place to build it rather than just talk about it. A couple of these techniques that we're going to look at today include basic stress management, identifying the stress in your life, and the counter to that, which is having a look at the joy, and also looking at problem-solving techniques rather than emotion-focused techniques, problem-solving techniques.
I'll just jump in there and mention, we've had a couple of people comment. Jane has said that she always tries to remember that there is never enough that she can give, and that she remembers to be proud of what she has done so far.
Yeah.
So changing your mindset around that.
Yes.
And also Leslie B has mentioned that she's commenced much more self-care by doing exercise and meditation.
Yay,
which is not true at all.
wonderful. And I bet you mean in a routine way, Leslie, like in a daily or a every other day kind of way, because that's the way to do it. Not just say, oh, look, I'll do meditation, or I'll do meditation once and then I'll feel better for a month. Is not how it works. So I'm sure that you've incorporated that into a really kind of habitual way, which is fantastic.
Ongoing.
Yeah,
yes,
ongoing.
That's right.
So just to reiterate that point with this quote, self-care shouldn't be something we resort to because we're so absolutely exhausted that we need some reprieve from our own relentless internal pressure. So I think Jane has hit on that as well, that sense of, what I've done should be valued and what I've done is enough in this instance, and I can never do it all. Being able to have very realistic expectations and to value and commend yourself on what you give is super important. So self-care is not about escapism. It's not about the glass of wine. It's not about the meditation. It's not about the trip to the hot springs, but it's about looking at your stress square in the eye and saying, what can I do to improve my daily activities and my resilience on a day-to-day basis? So here is a little model that I've ripped off entirely from the Resilience Institute, but I don't think they'd mind me sharing it. You can find it on Google. Lucky, just reassure Annie there.
Yes, that's right.
And I love this model because it shows you how resilience works. And I want you to have a look at that mid-line point, the point between the black and white and the coloured. So the midpoint of the page, that horizontal line, and that's the line where the Resilience Institute say most of us sit around that positioning, the general population, when we look at people's resilience. This is called the resilience spiral. We sit between this basic sense of stress management. They've called it master stress, so we have to acknowledge that they're American, so they've used different terms to maybe the ones we would use, but this master of stress, this ability to cope with stress quite well, and then just below that is this sense of, or this state of overload, of feeling a bit agitated, and also this idea of mindless busyness. And I love that term, mindless busyness, because I'm very good at doing that. I'm very good at kind of worrying about too many things at once that are not actually within my control right now. I'm thinking about what are we cooking for dinner tonight? I'm thinking about the fact that I've got to wash soccer clothes for my son tonight so that he's got them for tomorrow's practice, and none of those things are actually relevant to this webinar. And yet some of you might also be thinking about a few other things as you listen today that keeps you in this state of mindless busyness, or at least I want to say I'm not in that state permanently, but it comes and goes. And if we're aware of it, we can try and keep a better check on it. So the resilience spiral works like this. The more psychological resources, more resilience building activities you engage in and that you have access to in a routine manner, the higher you can spiral up into this much more lovely, you can read all these lovely words of self-knowledge and empathy and meaning and optimism, and an engaged presence even at the lowest level of that, above the horizontal line. The more we work on our resilience and the more we engage in self-care techniques, we go up the resilience spiral. It is much easier to slip down a resilience spiral, down a spiral, like a slide, a child's slide, I picture there. It's easy to buy into this feeling of being overloaded, being a bit agitated, this mindless busyness. If you're feeling that way and something bad happens during the day, then you can slip down another rung into that kind of feeling a little bit worried. You can get down into avoiding things, feeling a loss of energy. And it's a very slippery slope. And if we haven't been there ourselves, we've seen those around us who have almost easily slipped into this loss of interest, sadness, and it gets down into that word depression. I like that it's a spiral because it's easy to slip down into a lowered mood state. However, with a spiral, we have to acknowledge you can go up a spiral too. It's just a harder thing to do. It's easier to slip down, but you can climb up a spiral slide. And you can do that through a little bit of work and a whole lot of knowledge of how to.
It's a great visual. I think it's
good.
Fantastic. Yeah.
It's worth me ripping off Google, isn't it?
Absolutely.
Thank you. I'll take full ownership. The MS MS Limited was
Excellent.
not involved in that. Thank you, Annie.
No problem.
So this is another raise your hand, if you could. If you ever feel like you might be further down that resilience spiral than you'd like. Like I say, the majority of the general population sit at that midpoint between kind of feeling like they're in control and working on their stress and feeling okay, and feeling just a little bit overloaded and a little bit overwhelmed. And sometimes I use this visual with clients that I work with around their stress management. And I say, take this spiral home and have it next to your bed and just circle the words at the end of the day, circle the words that resonate with you, and they'll come back with lots of circles around lots of different words. And it's interesting to see that maybe they've got 25 circles on their piece of paper and where they sit above and below the line. And it can just be a nice point of self-education to say, oh, well, that's interesting that I feel quite overwhelmed quite often, and I'm feeling less of the positive above the line adjectives. So anybody feeling a little further down the spiral than they'd like to, Annie?
Yes, we've got about 6 people who have raised their hand. And yeah, I would say that I could be one of them myself.
Yeah, so that we fit into that.
Yes,
yeah,
absolutely.
And sometimes it's quite surprising when you think, oh gosh, I'm spending a lot of my time and attention under that midpoint.
Yes,
and,
at times, yes.
Yeah, and it requires attention. And there's a cute panda, so I had to put him on.
He is very cute.
He's putting his hand up.
Go panda.
All right. So how do we build resilience? I'm glad you asked. In our only 12 minutes left. So it's really about examining the psychological resources that you have at your fingertips. And of course, when they're at your fingertips, that means that you've worked hard to get them there, because they don't just appear. We have to find them and seek them out and figure out how we're going to fit them into our lifestyle. There are a number, and I believe Annie sent out a bit of a lightweight article that is online that I wrote for MS Australia that's about building a fortress of habit, and it details in lots of dot points different resilience building strategies, because it's not one thing that builds resilience, it's having lots and lots of different approaches across a variety of parts of your life. So some of the examples are here on this slide. Goal setting and training to work towards those goals. And one of the ones we'll look at is reducing stress. Practicing gratitude and kindness you would have heard about. Mindfulness you would have heard about. Meditation somebody's already mentioned. Exercise is a massive one in building resilience, even though I think a lot of people would say, oh, so are they related? Of course they're related. Exercise is so good for so many reasons. Learned optimism, problem-focused coping. We're going to have a look at that at the very end. And strengths identification, development and recognition of self-identity is a good one too.
I might just add there, Sally, with practicing gratitude and kindness, it's not just gratitude and kindness towards others, it's towards oneself as well.
Yes.
I think that's really important.
Yeah, it's really important. And really easy to say, yes, let's do that. And you think about it for a second and then you forget. But in order to use it as a resilience building tool, why not start tonight by saying, just for 1 week, just for 7 days, before I go to bed, I'm going to jot down 3 things that I'm grateful for about myself, or about the work that I did today, or about the connection I had with human beings today, the way I supported friends or family, or the activities I engaged in for my own self-care, and write them down. It's about the doing to make it real and to gain the benefit. Yeah, thank you.
Absolutely.
All right, so here we go, Stress Management 101. Gosh, I can talk a lot, Annie.
You're very
good
running
out of time. Okay, so I'm going to
talk.
fly through these. Stress Management 101, and maybe, we didn't hand out this. Well, there you go, you've got slides. So these are the 4 questions that I frequently give to clients of mine to get an idea of where is their stress and how much are they aware of the things that they're in control of and the things they're not in control of. So the first one is, what are your daily hassles? And these are not the big things. These are things like this. Oh, why does my family want dinner every single night? Okay, so it's a light-hearted approach to jotting down each and everything that adds to your bucket. Psychologists, we love talking about bucket of stress. So it might just be a little drop in the bucket of stress. It might be something a little bit more sizable, but we've all got many drops. So what are yours? Naming them will help you understand whether you have full control, a little control, not much control over these things, and if you're worrying about them at the appropriate time. Worrying about what you're having for dinner at 3 a.m. the day before is not appropriate time to be worried about something that you know you have full control over. Okay, can you identify your chronic sources of stress? So these are the big ones for you, not talking about your clients. This is for you. Do you have relationship difficulties? Do you have health concerns of your own? Do you have people in your life that you love who are in the middle of a health crisis? Do you have financial concerns? Do you have housing concerns? You know, have you still not done your tax from 17, 18, or is that just me? That might just be me. I've got to do that tonight. These are the chronic sources of stress that, unlike my tax, can't really be fixed in a day or two. These are ones that are just ongoing, but it's important for you to get them out of your head and onto the paper so that you can identify that this is fueling some of that worry in your head. So these are, I should have just put these in here. So these are the examples of chronic sources of stress: finances, housing, health, love, communication as well. Can you identify your regular moments of joy? So I'm constantly shocked at how many people, not just my clients, but health professionals I work with, general friends that I talk to, where are your moments of joy? And they might be able to list one or two. And often they come from human beings. You know, it's their kids or it's their pets who are kind of human beings. It's their friends. That's where they get their joy. And I encourage people to find joys in lots and lots of areas so that when they experience it next time, they are aware that this is a moment that they're meant to find joy-provoking. So here's my first one: coffee, a good cup of coffee that doesn't actually look like that, because when I get it, it looks a bit like that. But then I was shamed into getting a keep cup, so mine looks a bit like that. Now, except if anybody has a Frank Green one, you'll know that I'm so frustrated with that lid. I don't use the lid anymore.
Oh.
I just use the cup, and then I question, why didn't I just get a mug from home? Anyway, my own problem. This is one of my joys, going to bed at night, particularly if I've turned my electronic blanket on. That's what they used to call them, electronic blankets. I also love my dog, Rosie. She's a source of joy. I love my pajamas. Again, they come up there. I love singing in the car, and there's been recent research that tells us how good that is for us to sing out loud in the car. Wonderful. Look at all the endorphins. I don't sound like Adele, obviously, but I thought I should clarify just in case you confuse me with her.
That's okay. You might sound like James Corden.
Yeah, there you go.
He sounds all right.
He sounds all right too.
Yeah.
I love a good cup of Earl Grey tea. You can see when I'm doing sunrise or sunset, although I'm realizing my age now that I tell people that I really enjoy a good sunrise. And Netflix, of course, is always joyful to have that time on the couch. And setting a goal and reaching a target brings me a great sense of joy as well. So I wanted to share those with you just so it gives you something to think about. There've got to be lots of little joys. You know, being joyful around your jammies and getting into your pajamas at night, that's okay. And if you actually feel that way, then why not feel it a bit more by bringing it into that state of consciousness by writing it down. And also, can you identify any big or unusual things that you're looking forward to? So it might not be the trip to Fiji. I've never been. You might have been. You might have experienced that beach that we're looking at now. But it doesn't have to be that. It can also be things like catching up with a friend that you really like, or a Netflix series that's about to start, or I don't know, it can be a day off. I'm not against that. I'm not opposed to that in self-care, but it just doesn't have to be all about that. Okay, now I'm speeding through, 5 minutes to go. Learned optimism is a thing, if you haven't heard about it before. We used to think that you're either a half full or a half empty kind of person. Now we realize that actually, if you would prefer to be a half full kind of person, you can learn how to be more optimistic. And that includes learning how to apply a problem-focused coping strategy to life rather than an emotion-focused coping strategy. So, sorry, one more slide about pessimists and optimists. A pessimist complains about the wind. The optimist expects it to change, and the realist adjusts the sails. And I guess that's something that I think we should all be a little bit more of. It's certainly something that I encourage my clients with chronic illnesses to embrace, this idea that being a realist is so much better than being a pessimist or an optimist. It will really affect very sustainable change. So I'd encourage you to adjust your sails rather than ignoring what's happening. If you feel that burnout is approaching, or if you feel a strong sense of overwhelm, don't ignore it. Don't think that it's going to get better after you have a day off in May. It's going to be there when you get back from that day off, or when you get back from the exercise or the meditation. So it's important to talk about it and be really proactive in taking solution-focused approaches and making lots of little changes to build resilience generally, and then it will have a flow-on effect. Part of that is examining your coping style. I'm aware of the time, Annie. So problem-focused coping is put to people as the preferred coping strategy, much more so than emotion-focused coping. And you may know a little bit about this. Emotion-focused coping is often something that we see in people who are grieving the loss of someone. Someone has died, and we will encourage them to talk about it. We'll encourage them to talk about the person who has died without seeking a solution, because of course that person has died. We can't bring them back. So emotion-focused coping is often really effective. It includes things like praying. It includes, if they're that way inclined, it will include things like being mindful, about going for a walk, about being kind to yourself. They're all really important things if the situation calls for that, like grief. There can also be negative or maladaptive emotion-focused coping strategies, and they include things like having too much wine. They also include, you know, the classic escapism of risk-taking behaviours, drug-taking, or we see more often now, unfortunately, particularly among young men and even not so young men, escapism through devices, through Nintendo, for example, or computer games. These aren't fantastic coping styles to apply to feeling burnt out at work. Emotion-focused coping styles are not great in that space. Problem-focused coping styles are. So this is really about looking your stress square in the face and saying, what is the fundamental cause here? And what can I do? That will often include time management strategies, talking to your boss, increasing your own resilience levels, but also going to the source and figuring out there's got to be a better way of doing this. And so really implementing problem-solving strategies. That was a very brief wrap-up of those 2 points there, but to just put a little bit of humour into the end of this presentation, I also wanted to show you a little video that I am really, really hoping will flow through our streaming here. That's what it's called. The YouTube clip I want to show you is called It's Not About the Nail, and I've written it there because if it doesn't come through, it's only 100 seconds long, so if it doesn't come through, bear with us. It'll finish soon, and I would love you to find it on YouTube after this webinar if you don't get to see it streaming to you now. I want to make the point that it's gender stereotypical, but men and women are both very good at problem-focused coping and emotion-focused coping. We both delve into both. And in this video, the woman will exhibit the emotion-focused coping style, and the man will be all about the problem-focused coping. Oh, that's what that one says. And so bear with us if the streaming doesn't work, but let's see how we go. And make sure that your volume is turned up, maybe before I press play. So this gives you a chance. It only goes for 100 seconds, and then we'll be back to wrap it up. Here we go.
Sure.
Let's see if we can. Oh, no. Here I am trying to press play, but it's not. Yeah, look, it'll. Oh, no, there we go. Here we go. That's how it's going to show it. I don't know how that went. We've got Annie's computer over here as well that was streaming it maybe at the rate that it was streaming to you, and it wasn't great, and I'm really sorry about that. I hope that some of you were able to see the humour in that, even though it was a bit stilted. If you would like to, please do have a look at it on YouTube. It generally makes people have a little giggle. So just in wrapping up, because I'm aware that you all want to get back to whatever work it is that you're probably having to do at 3 o'clock, please have a look at some of the tips around building resilience and acknowledging that it is really a very active process where you have to really be engaged in building things into your routine. Making things a habit is the best thing you can do so that you don't have to rely on your willpower, so that you can just rely on great strategies that you've put in place because you know of the long-term benefits. Have a look at where your stress sits and where you find joy in life, and just be really conscious of those moments that you've designed to be joyful so that you can involve yourself in the joy and enjoy it when it happens. And have a look at around the different emotion focused coping skills that you use and the problem focused coping skills. Use a bit of both depending on the situation, but maybe work a little harder at incorporating a few more problem focused coping strategies to your life. And I guess just a reference to that article that Annie has provided you with, there's this idea of having a fortress of routine, because if you are developing your self-care plan around lots of little great health promoting strategies like exercise, like gratitude, like talking to people, like building meaningful relationships, there are so many, like stress management, there are so many options to build just little block by little block, so that when a challenge comes across your path and gets thrown against your fortress, you will have such a fortress of routine and great self-care strategies that hopefully the challenge will be more likely to kind of just slide off and you will deal with it in your stride rather than having a catastrophic event or burnout. Oh, that's just that front page of that little article. And I just want to say thank you very much.
Thank you, Sally. That was really wonderful. And I've just had word from Jane saying that there was no sound.
Oh no!
And I'm hoping that's just in relation to the video, and that you can still hear us now. But as Sally mentioned, the name of the clip is "It's Not About the Nail."
Yes.
So if you want to view it and have sound, please
YouTube.
Google it or YouTube it, and you can view it that way.
Yeah.
Okay. All right. Thanks for that, everyone. Now there are a few final slides. I realise we've gone over time, so for those that have to leave, that's okay, but I encourage you to stay on and just listen on quickly. I'll only take another few minutes and go through some slides relating to MSL, and also there's a survey at the end of the webinar. Once we've closed, it'll appear on your screen, and we ask you to please complete some feedback. Okay, so this slide here represents the services that we provide to our clients. Just running through them quickly, you may not be able to see them all, but our MS Connect service provides information and advice and links people to services and supports. This could be the MS Advisor, it could be MS Employment Service, the MSP Support Service, our MS Education sessions, as this is one of. The Go for Gold Scholarship, which is a one-off funds for people who want to realise a dream, whether that is education, travel, the arts, or whatever. There's also Financial Assistance Program, which provides funds for people who are experiencing financial difficulty. So there are lots of services available for MS clients, and we encourage you to go to our website and have a look at these services and see if these can help your clients in your practice. The next slide talks about the MS Practice PDF forms. These are available. They're free and online, and they provide evidence-based information and clinical practice recommendations to help to enhance the quality of care and the outcome for people living with MS. Okay, we are a registered NDIS provider. Listed on your screen, you'll see the services that we currently cover in the different areas across the states. Okay, just a word on our free ebook platform. You can get these ebooks from EBSCO, and you'll see there that there's the link to access it, and there's the username and the password to access these books. You simply click on the right-hand side where you see the highlights carousel and click View All, and I believe that there's about 25 books to choose from.
Is there?
Yeah.
That's fantastic.
It is great. So you're welcome to view these at any time, and they're free.
That's great.
All right, so that's the end of our webinar, everyone. Thank you very much for attending, and a big thank you to Sally for providing the wonderful information, and I hope it's been helpful to everyone out there. In the meantime, if you have any further questions or comments that you would like to make, please feel free to do so. You can ring us on the free call number at MS Connect, that number at 1800 042 138, or send us an email. And I'll just have a look and see if anyone's typed in any further questions. Doesn't look like it. So thanks everyone for joining us this afternoon. Wishing you all the best. We'll close for now.
Thanks, guys. Bye.
Thank you, everyone. Bye for now.